But women's health isn't exclusively reproductive health. In fact, there are a lot of other health-related conditions that impact women more exclusively. So things like autoimmune diseases like lupus and rheumatoid arthritis have a higher preponderance of impact for women. We're seeing things like osteoporosis, which we know there's treatments out there, but they're certainly cost prohibitive for women as well. And then, of course, things like breast cancer screening is very important for women. So again, it's not just health either. So my definition of women's health is much more broad than just classically clinical health.
I want to welcome you to another episode of Healthy Savings. I'm your host for today, Gotham, the co-founder of Milu Health. And today we have Gretchen and Lindsay from Alera. How are you guys today?
Great to be here.
Great. Good morning.
Why don't we start with some quick introductions? Gretchen, you want to start first?
Sure. So my name is Gretchen Day. I am VP of Health Innovation and Advanced Strategies, which is a long title at Alera Group, which means that I get to work with employers on their health and well-being strategies, their population health initiatives, and their cost containment approaches to managing their health plan. I've been with the organization for 10 years. I have grown in this space, coming from a public health background. Never thought I'd land in insurance, but here I am.
And I'm Lindsay Humphries. I'm a benefits consultant also at Alera Group, partner quite often with Gretchen. So excited to be here together today. I actually am fairly new to the insurance world. So I joined Alera Group just the end of 2023, but I've been consulting with HR folks in various capacities for almost 20 years, which is hard to say. So excited to have us both bring our different, unique perspectives.
And we were just talking, I think this is the first time that we've had two guests, by the way, on the podcast. And so we're excited to do it in this new format. So one of the things that we were just spending a few minutes before this whole episode, just catching up, and we were talking about how different people have landed up in the space. And I feel like most people just happen upon it, or they have a random path that has led them to the space. Would love to hear your stories about how you found out about the benefit space, health insurance, how you got there. Gretchen, I know you said that you have a bit of a circuitous path. Lindsay, it seemed like you knew exactly what you want to do, that you actually want to do this since you were a kid. So would love to hear how both of you guys have landed in this space in slightly different levels of intention and strategy. But yeah, Gretchen, why don't you kick off?
Sure. So I actually never knew this industry existed until I started with this organization. My background, actually, I'm a biochemist by training. I got my undergraduate in that, and of course thought like I should go into research and study, and somehow landed in veterinary medicine. Of course, a natural transition. I worked in the veterinary medicine space for about 7 years, and I loved it. I love animals, but I also found that it was a very somewhat exhausting and mentally taxing industry. Kudos to everyone who works in that space. It is definitely emotionally ridden. So, of course, I took that path and then went on to get my master's in public health. And within that program, I learned all about the healthcare industry, all about insurance. And of course, the decision from that was like, absolutely never want to work in insurance. And of course, then I found an opportunity with my organization, with the Alera Group, and started working in our population health segment, which was more of a natural transition. I started in the population health realm, focusing on employer well-being strategies, helping employers consult in that. And my evolution within Alera Group has just continued to grow as we've learned that well-being is not a kind of a single approach for every employer. It's very nuanced. It's not a one size fits all. And so we've had to learn and adapt and embrace new strategies for employers as they seek to design more holistic approaches. So I feel like I learn something new every day, which is fantastic. And that's why I love what I do now. And I get to help employers deliver better healthcare experiences for their employees, which supports the passion of the public health entry that I came into the space from. Definitely not where I expended.
I know. This explains why we need more pet benefits as well, right? I feel like that's how
of course
that past life and the current life together, right? We need to make sure that our pets are taken care of as well as the people on the plan. And then, yeah, Lindsay, how did you get here? So I know that you had a bit more of a path towards benefits. What was your path to this?
Yeah, so my path is definitely a bit different. Like I said, I'm newer to the industry. So it's been a really fun and interesting journey so far. But my path is a little bit different because I've been consulting in the HR space, like I said, for quite some time. So I had a bit of exposure to the health insurance side, and was always very intrigued to kind of jump into the benefits space, mostly because of the complexity associated with it. So I keep telling everybody that I wish I did this 10 years ago because I've never been happier in my career. I think it's really a combination of the complexity and, unfortunately, such a broken healthcare system that there's so much to solve, which really gets me energized to really try to understand the health system better and try to help my clients get clarity and an understanding to actually drive and impact change and deliver better health outcomes at the end of the day. So it's been a really fun and exciting journey, but took me a long time to get here, but here I am.
I totally agree with that, by the way. Like, I think not a lot of people think about benefits and insurance and are just like, wow, that sounds so exciting or interesting. But when you think about the impact you can really have in healthcare, it's huge, right? There's so many people in the country that need better access to care. They need better quality care. They need better cost of care. And, you know, one of the most powerful ways you can actually affect that change is through this whole system of actually figuring out what are the benefits that employees are on and the insurance that you can get.
Absolutely.
Yeah. Agreed.
But no, and I also want to, one of the things I also know that we've talked a bit about is this whole space of benefits and health insurance and employers, right? It's a really interesting space. It's also a space that historically has had fewer female voices and female leaders in it. And, you know, I know that, for instance, when we go out and we go to a lot of these conferences, you know, a lot of the dinners or a lot of the conferences, you see a lot more guys. A lot of the dinners are typically steakhouse dinners. Is that type of an energy? Would love to hear what your experiences are, you know, in the space, bringing that perspective to the table and that voice to the conversation.
I can jump in first. So I would say, honestly, that was one of the other reasons I was really excited to come into the benefit space, because I felt coming in with a female perspective could be really impactful, both for, for my clients, potential clients, but just in general. One of the biggest things that I've found since working more intensely in this space is I've just been completely amazed with the limited research and information as it relates to women's health. Mm-hmm. So being a female myself, that's definitely much more of a passion for me to really dig in and better understand the impact, the differences in the impact of disease and health as it relates to women and different genders as a whole.
And Lindsay, that is true in the well-being space. We're talking about women's health much more frequently with our clients than ever before. As employers are looking to differentiate their benefit strategies and embrace more women supportive benefits, family supportive benefits, that is becoming a greater aspect of every conversation in well-being as employers are thinking more holistically, more broadly about redesigning their benefit offerings. I would say the other thing uniquely from a female perspective, one of the things that I think Alera Group has done really well, and I encourage many employers to think about, is we launched a women's mentorship program, of which I had the opportunity of being a mentor for other younger women entering their career path within Alera Group. And I think it's been a really supportive opportunity to help individuals grow, help them navigate this industry in whatever kind of area they might be involved in. And so I think employers considering those types of offerings, whether it's a mentorship program or it's a peer-to-peer opportunity, those are really great advantages. And I would say that has definitely helped my career grow and blossom. And I think the other advantage of that is that we've also had some male allyship. I know that we have a number of male mentors, part of that women's mentorship program, that have really helped and supported women. And I think we need more of that.
Totally agree. And like, I think that, you know, it's also our health, the healthcare has to represent the patients, right, that you're trying to cover, right? And I think that especially in the employer healthcare space, over the last 70 years, we moved from a paradigm where you do have more women entering the workforce. They're working longer. You're having kids while working. They come back after having kids. Some of that stuff didn't happen in the 1950s, right? But then as a result, the employers and their healthcare have to evolve with now the employees that you're actually covering care for. And I feel like there's a bit of a learning curve that happens sometimes in terms of trying to figure out how do you support some of that. I mean, I think when you think a bit about women's health and in some of the groups that you're working with, what do you feel are sort of the big opportunities? What do you feel are the remaining problems? What do you feel are sort of the big opportunities that happen? Are we there yet? Are we actually providing the good care that we need to for the female employees in the workforce? Or do you still see large gaps that are remaining?
I would say that's a hefty question. You have asked a lot. So I think one of the biggest opportunities for employers is to think broadly about women's health. I think historically, women's health has been pigeonholed into exclusively reproductive health, things like fertility benefits, maternity benefits. We are seeing that broaden now to talk more about menopausal health. That is really a new transition within the last 1 to 2 years that's starting to be talked about more with employers. But women's health isn't exclusively reproductive health. In fact, there are a lot of other health-related conditions that impact women more exclusively. So things like autoimmune diseases like lupus and rheumatoid arthritis have a higher preponderance of impact for women. We're seeing things like osteoporosis, which we know there's treatments out there, but they're certainly cost prohibitive for women as well. And then, of course, things like breast cancer screening is very important for women. So again, it's not just health either. So my definition of women's health is much more broad than just classically clinical health. As we think about women's health, I think it's also embracing other holistic aspects of well-being, areas that impact women much more explicitly. Things like caregiving support, as we know that a quarter of the working population is a caregiver, whether they're in that sandwich generation caring for both children and adults. We know that the majority of them are women, not exclusive, but we do know that a lot of women handle that role. We know that mental health impacts women much more exclusively. Areas like financial well-being is a very big opportunity for women to be supported, that maybe they weren't kind of dealing with the finances of the family in the past. So when I think about women's health, it is a much more holistic approach than just focusing on reproductive care.
Yeah, and I would just add that to Gretchen's point about thinking about women's health beyond fertility, I think it's very much exciting that it's more of an open dialogue and conversation. But to answer your initial question, I think we're just getting started. Mm-hmm. I think women themselves are actually very undereducated about our own health, myself included. We're learning new things every day. And even the discussions around menopause, while I think it's great that it's getting a platform, I still think that most folks, whether they're male or female, have very little education and understanding of the correlation of menopause and treatment during the menopause years and how that correlates to disease, heart disease, Alzheimer's. Women experience much higher rates of those diseases as a result of menopause, is what the latest research is showing. So I think we really are just getting started to really understand how the different phases of a woman's life really impact true health.
I think that's a really good point. I mean, I feel like there's a much greater continuum right there in terms of the services that you need to actually provide for healthcare, right? It's not just at one point in time, and it's not just fertility. It is a much broader set of services that are required. It's also an interesting point where the whole point about education, right? Like I feel in this whole space of benefits, right? One of the things that comes up as a theme quite often is engagement rates, right? Like how much are employees actually using it? Do you feel like there's more education therefore that's required, in order to actually make sure that people are aware of it sometimes, like, to try to provide that education and be like, hey, you may not know that this is something that you should be thinking about, but this is something that is coming or something that is relevant. And here's a way to actually address it.
I definitely think education is key. As Lindsay suggested, there's a lot of kind of miscommunications or misideas in the healthcare space that women don't know that they can ask, or they don't know that their symptoms are unusual. I think that's a huge barrier, that if women are kind of just assuming things are normal and they're not addressing those situations or issues with their physicians or talking to the right physician, because we also know that's another challenge in the healthcare space, that not every physician is very well versed in a lot of women's health topics. And so finding the right doctor, asking the right questions, being empowered as a patient to stand up for your own health and address your concerns, I think is vastly important. And I think there's a lot of education needed in that space.
Yeah, I completely agree. And I can even give myself as an example that, starting to dig in and do more research and understand which doctors are actually qualified to support women at different stages of their health. And I live in North Jersey, actually a stone's throw from a massive hospital healthcare system. And as I dug in and did the research, I can't find any menopause certified doctors that are within reason in my area, which is just eye-opening and kind of shocking, that the providers that we're seeing and going to and trusting with our health aren't actually equipped to serve us in many instances.
So in terms of like how you think about women's health across, the clients that you guys are working with at Alera, you guys are seeing clients all throughout the country, different demographics, different industries, different types of folks. Are you seeing different types of things that people want across those clients in terms of the women health services, in terms of benefits, in terms of the disease like support?
Yeah. So I think it's very much unique to every employer. I mean, every employer has different employee population that they're trying to solve needs for. But I do think that it is becoming something employers are looking at, embracing, and addressing. But I think it's incumbent on us to help inform our employers what exists out there. I think there's lots of solutions that are coming to the market. This is an ever-evolving landscape. New solutions are entering this space all the time. And so I think when employers look to us as a benefits consultant, we're incumbent to provide them with information and ideas and suggestions that really are going to resonate with their employee populations. Our goal is to help engage those employees then and make sure that they know about these solutions, that they know when to use them, know how to use them, know when they're most appropriate. But we really want to connect the dots for employers. So yes, are we getting questions now? Yes, most definitely. But I think those questions and inquiries are really incumbent on us to help open our employers' eyes to what else is out there.
And, I would love to hear, are there any examples you have of like when it actually works? Like, is there an example that you can think of where there's like an employer where it's like they had this gap, they wanted to engage you guys and figure out what's a solution that can actually address that gap, and then actually seeing it get executed and having that kind of impact?
Yeah, I think these conversations are just starting. I have kind of employers across the spectrum. I have an employer who years ago actually came to us and said, we want to add midwifery and doulas to our plan instead of just covering the traditional birth center model. So they were very progressive for their time in wanting to explore something. And of course, that means adjusting their benefit designs, making sure we're allowing for in-network coverage for these types of care that may not standardly be part of their benefits. I just saw this morning conversation going back and forth with a very small employer who's in the fully insured segment who wants to add a robust IVF program to their benefits. And how can they do that? We have employers who are looking for added menopause care. And so we're seeing exploration of virtual menopause offerings. And so it is very varied, for lack of a better word, in how employers are addressing these. And I think that's where we're unique. We get to bring creative ideas. That's what I love, is bringing creative ideas to our employers. And how do we approach this that's going to meet and solve for their employees' needs?
And in terms of, how you think of your position, what like, to what extent is that you're working with a client and they're like, hey, this is an existing problem I have, to you're saying that, hey, actually, you know what, this is a gap you're not aware that you have, or that this is a solution that you need. How do you think about, is it, client driven, trying to think about the strategy, versus you guys trying to figure out that, hey, this is sort of how we would think about a health plan that is supporting your employee population?
So I would say that, especially when you think about middle market companies, being more strategic about your overall well-being approach, I think, is becoming more and more important. The days of just trying to fight down your renewal each year are really coming to an end, because you really need to take a holistic approach. You're not going to change your whole program overnight. You really need to start thinking about 3, 4, 5 years from now, where do you want to be? And as it relates to women's health, that's just one piece of the overall consulting that we would engage on. But the recommendation is always that you need to have a strategy and start to think about how you're going to move the needle over time.
And I would add to your question, or an answer, is that it's not just incumbent on employers to bring us ideas. That's part of our role and responsibility, is also to bring our employers ideas. And sometimes it's not looking at traditional data sets either. It might not just be looking at medical claims, because sometimes there's an absence of what's there. Sometimes it's looking at what's not there is really identifying a need. But it's also looking at other data sets for employers. An example of one, I have an employer that they're hiring a very young demographic, and they're also finding that women are, after they have a new baby, are not returning. And so we've been working together in a long time to look at their short-term disability metrics to identify how many women are going out on short-term disability and how many are coming back. And so working together, we've discerned that they need caregiving resources, they need childcare opportunities, they need benefits to help support those women so that they have the resources to return and continue to be a successful employee while making sure that their children are cared for. And so it's not just clinical data that helps drive some of these recommendations.
It's also an interesting point, right? Like, I think in some ways the role of what we're trying to do in this whole space of benefits and insurance is, it's a lot broader, right? I mean, I think that in terms of how do you make sure that you're really supporting the broader population, the whole employee pool, and thinking about it from different spaces. I mean, data in healthcare is such a pain, right? And often that it's messy, it's not always structured, and I think the whole point, especially about what data doesn't exist, is also a really interesting point, both in terms of because maybe the data is messy, but also maybe because people aren't getting the care they need, and how do you actually address that and address those problems too?
That's completely spot on. I mean, the data that isn't there lends towards gaps in care. We see that people aren't getting screenings, and that could be a myriad of reasons. It could be that they can't get in. Access is a big issue. Sometimes you're delayed 6 months before you can get an appointment. But there's also some educational barriers. I've read a lot of studies that indicate that people defer on care because they're afraid of what they're going to find. They don't want the answer. They don't know. And sometimes that can be off-putting for a patient, not wanting to pursue that screening diagnostic that could tell them if they are at risk for a cancer diagnosis, but they're not prepared to deal with the result. And so I think there's an educational barrier, there's an access barrier, sometimes there's a cost barrier for services as well. And then it's also time management. Sometimes time management is challenging when you're juggling a family and work. Taking time off to go to the doctors is tough too. So all of those things contribute to some of that missing data points that help us understand a population, make recommendations for an employer.
On the access of care point, because that goes back to, Lindsay, what you were talking about beforehand, right? About your challenges finding a doctor's, locally even, right? How do you think about that? Is that something that you can solve? If is it something that you can find a solution to try to provide a bridge there? Or if, a patient's in a population where maybe there are fewer places where they can get, good support for women's health, it's just harder to provide that support. How do you think about bridging? Are there ways that we can actually bridge where there is less access to care?
So I'll chime in. I think the advantages of virtual care delivery models and the expansion in that realm has certainly helped improve access, where you may not be able to drive to the physician, but you can connect with them virtually. We're seeing that help close gaps in access around mental health. We're seeing it. We've seen a lot of initiatives in the menopause space. There are several new vendors out there that exclusively provide virtual menopausal care. So I think those are going to continue to be the stopgap when there aren't enough physical resources in a community, wherever that employer's site is. So I think we're going to see more and more of that evolve. And I think it's a great thing that people have access to care in that format that they never would have had before when we think back 10 years ago.
Going back to the point of we're still just kind of scratching the surface. I mean, the amount of money being put towards women's health research is still just barely anything. So while we can do the best with what we have today, there's just still so far we have to go to really understand how to serve women and their health appropriately.
Makes sense. I mean, I think healthcare is just such a slow space, unfortunately, right? And the pace of development, for good reason, takes a lot of time to make sure that there's a lot of progress. But it can be frustrating when there's been a lot of catching up to do, and you still have to face that slowness in terms of progress, for sure.
The good thing is that we are progressing, and I think that's great that we are. This is a movement. We're seeing more conversations like this occur. Even then, when we look back 2-3 years ago, we weren't having this much dialogue about women's health. And so I think that is helping to push this initiative that employers are taking more notice on. And I think that's going to just help continue to snowball this space.
So if you're an employer, let's say you're a mid-market employer, you're trying to think a bit about, hey, maybe there's a gap. I don't know if there's a gap. They're just sort of trying to now, they're like at the initial points of trying to figure out what do they do here to support better women's health practices for their group. Where do you start? Like, what do you think about? How do you ask that question? Who do you ask that question to? If you're just trying to start on the whole journey of providing better services.
So I think it starts from an employer perspective is connecting with your consultant. That consultant should be helping you build a strategic plan, helping you lead into what does the next 2 to 3 to 5 years look like? How can you expand the services and benefits that you offer to match with the employees that you support today, as well as the employees that you support in the future? I know, Lindsay, you bring a really unique perspective given your role. Do you want to kind of expand on that and how you're working with employers?
I think understanding the makeup of your population is a really important starting point, looking at your demographics and understanding not just the gender differences, but, the generational differences, because I think what's needed is really where you should focus really is going to depend on where you're going to make the biggest impact and making sure you understand the makeup of your organization as a whole. And I think from that lens, it's a really good starting point to start to put in place a longer term strategy of where you want to be, especially when we're expecting that. I think it's just within 5 years, 70% of the workforce is going to be Gen Z and millennials. So if you're a company today where you're not thinking about the needs and wants of those generations, you got to start thinking about it today to make sure that 5 years from now, you're still an attractive employer and actually supporting your population. So I think starting there is a really important place to really get a good lens of where you need to focus and figuring out your gaps from a generational perspective, as well as from a gender perspective.
Makes total sense. And then I know that this sort of goes back to what we were talking about even as well beforehand. Gretchen, I know you were talking about how at Alera, there's there's a committee that basically reviews the strategy for the whole space and try to figure out what to do for employers. Would love to hear how you guys think about, that whole strategy, that whole game plan for those next 5-10 years and supporting some of the clients and what that playbook could look like.
We have lots of individuals kind of thinking about this. I know within Alera Group, we have a women's health initiative that is building out the strategy of what employers should be thinking about. What are these big topics? And we have lots of kind of inside and external kind of thought leaders involved in the women's health space who are contributing towards the steering committee. So we know that it's important. We are working on some women's health initiatives for our own populations. And I think that gives us insight into how can we employ this in a workplace setting? How can we distribute this to our employers? If we have firsthand knowledge of building our own women's health coalition, we can share those insights with our employers as well. We can attest to this works and this is successful. So we're very excited about some of those initiatives. And I think in the long term, that will help us influence and guide our employers in the next 5-10 years and giving them all the insights of how we've employed it in our own workplace.
And then in terms of how you guys think about how women health fits into broader employee health and, broader themes of well-being and support. How does this connect into other programs? Do you see it as a standalone product or a standalone service, or does it have to be framed in the broader context of other services that employees are getting through their benefits and their health plan?
So I'd say it's a both and. Certainly, can you launch with a women's health solution kind of standalone? Yes, by all means. And I don't want to discourage employers from doing that. But I think it's really important for employers to think broadly about their well-being strategies, especially as we lead into this very dynamic year. What we're forecasting trends for well-being this year are really focused around 5 key areas. And we believe that at the core of that is focusing on building a culture of belonging. So as we talk with employers, we're thinking about that lens of how do you help support your employees feel like they belong and they trust your organization. And with that comes some other categories. Mental health is one of them. Women's health is very important. Those aren't going away. But we're also expanding to think about areas around aging and inclusion. As Lindsay just showcased, we need to think about how are we supporting different generations, designing benefits to support those newer entry employees, but also supporting your employees who have been there for a long time, taking advantage of their expertise and using that in a way of building mentoring programs, forming connection. We're finding that employees who are newer to the workplace don't have that foundation connection with other employees, especially in kind of the historic upheaval we've had over the last few years with people being remote or hybrid. They haven't formed the ability to connect. So connection and belonging is very important. And then I would add that the other area that we're seeing a lot of conversation around is thinking about longevity. And it ties into all of the things we've talked about. So from a longevity perspective, you're hearing those terms kind of trend, but we're thinking about shifting from a lifespan to health span. We want to create better years of our life, have a better health overall. And so changing that perspective, we don't want to just live longer. We want to live better longer. And all of that, I think, wraps into where we kind of are approaching well-being this year. We're just thinking about how do we think about things differently? How do we form connections? How do we improve the years in our lives? It's a big year.
It's a big year.
There's nothing I can add to that.
Well, I think that's a great way to end the podcast. Lindsay, Gretchen, thanks so much for joining. Really appreciate the conversation, and thanks for everyone listening.
Thank you.
Thanks for listening to Healthy Savings by Milu Health. If you would like more information about any of the topics you have heard today, we would love for you to get in contact with us. Find us on the web at miluhealth.com.